Hi, my name's Tim Cruz, and I'm the District Attorney here in Plymouth County. Thank you for your interest in the issue of drug endangered children. According to the National Alliance for Drug Endangered Children, 2.1 million children in the United States live in a home where a parent uses drugs. Children who encounter adverse childhood experiences, or ACEs, often exhibit negative behavior. Other children coping with ACEs may fly under the radar, undiagnosed, and that's where you come in. Our office has many goals and objectives when it comes to aiding drug-endangered children. One of the most important, and one of the main reasons we created this video, is to offer education and training so that in your important profession, you're able to identify children coping with ACEs and get them the help and attention that they deserve. Our Plymouth County Drug Abuse Task Force Drug Endangered Children Initiative has the primary objective of identifying children impacted by substance use in their home and connecting those families to services. Our office remains dedicated to providing awareness and education on what ACEs are, the risks drug-endangered children face, and what can be done to help these children. Thank you for doing your part to work alongside us.
The Plymouth County Drug Abuse Task Force Drug Endangered Children Initiative, or DEC Initiative, is a grant-funded program with the primary objective of identifying children impacted by substance use in their home and connecting those families to services. The DEC Initiative is also training first responders and schools on trauma-informed practices. The initiative bases many of its strategies on the science of the Kaiser Permanente ACE study. According to the CDC Kaiser Permanente Adverse Child Experiences Study, commonly referred to as the ACE study, is one of the largest investigations of childhood abuse and neglect, household challenges, and later life health and well-being. The original ACE study was conducted at Kaiser Permanente from 1995 to 1997 with 2 waves of data collection. Over 17,000 health maintenance organization members from Southern California receiving physical exams completed confidential surveys regarding their childhood experiences and current health status and behaviors. The original study identified 10 adverse childhood experiences in 3 broad categories. In the category of abuse, there is emotional, physical, and sexual abuse. In the category of household challenges, there is mother treated violently, more commonly referred to as domestic violence, substance misuse in the household, mental illness in the household, parental separation or divorce, and parental incarceration. In the category of neglect, the study identified emotional and physical neglect. The ACE score is the total sum of the different categories of ACEs reported by participants. Study findings show a great dose-response relationship between ACEs and negative health and well-being outcomes. In other words, as the number of ACEs increases, so does the risk for negative outcomes. ACEs are common across all populations. Almost 2/3 of study participants reported at least 1 ACE, and more than 1 in 5 reported 3 or more ACEs. Some populations are more vulnerable to experiencing ACEs because of the social and economic conditions in which they live, learn, work, and play. Since the original study was published, other ACEs have been identified. It is fair to say that since March of 2020, we have all experienced the impact of the global pandemic. Children experiencing adverse child experiences often exhibit negative behavior, but some fly under the radar because they have learned not to rock the boat. The behavior of some traumatized children may look like bullying. It is important to implement trauma-informed practices for all children you encounter through your work, so that the child who copes with perfectionism gets the same support as the child who acts out. In addition to behavioral issues, children impacted by adverse childhood experiences may also experience changes to their mental well-being. There are long-term public health impacts from adverse childhood experiences. By addressing childhood trauma and giving children healthy coping strategies, we can help disrupt cycles of abuse, neglect, violence, and addiction. A 2016 survey of juvenile defendants in Massachusetts showed an average of more than 4 ACEs per respondent. ACEs are related to many other issues we're facing as a society, but just as the risks are related, so are the solutions. In Plymouth County, we have developed a communication protocol between first responders and schools we call Handle with Care. The Handle with Care protocol is simple. When a first responder encounters a child at a scene with any potentially traumatic situation, they get the child's name, age, age and school. The school is then notified with a Handle with Care message. The Handle with Care message does not violate the child or family's privacy. No details of the event are shared. It is just a heads up to the school to be prepared to give that child extra support. Without Handle with Care, a child who witnesses a traumatic event might act out at school the next day and get punished for that behavior. When the school has received a Handle with Care notice, they can respond in a supportive way that avoids punishment. In a study of Handle with Care's effectiveness at schools in Brockton, a significant decrease in office referrals and suspensions was documented. In 2015, the Plymouth County District Attorney Tim Cruz and Plymouth County Sheriff Joe McDonald organized local experts in the law enforcement, education, medical, prevention, treatment, and faith-based areas of communities to form the Plymouth County Drug Abuse Task Force. This task force provides Plymouth County with a clearinghouse of resources and best practices. In 2018 and 2022, the Drug Endangered Children Initiative, or DEC Initiative, of the Plymouth County Drug Abuse Task Force received federal grants to support their efforts to identify children impacted by substance use in their home and connect those families to services. The DEC Initiative also offers training to first responders and schools on the trauma-informed practices. In partnership with Plymouth County Outreach, the county-wide police-led overdose follow-up program, the DEC Initiative is connecting families impacted by overdose to resources and services. We would like to identify families in need of this kind of support before overdose occurs. Our area has been particularly hard hit by the opioid crisis. Heroin and fentanyl use are the most urgent substance use issue in our communities. But substance misuse can occur with alcohol, marijuana, prescription medications, and other illicit drugs. Children who live in a home where there is problematic substance use are at increased risk for emotional and physical neglect and abuse, sexual abuse and human trafficking, and early substance use themselves. We have focused on families impacted by overdose for several reasons. We know most overdoses occur at home. We know that a large percentage of overdose victims are between the ages of 20 and 39, the age of parents to young children. This photo is from a real crime scene in Plymouth County, where an infant died from exposure to heroin. It is happening here. According to the National Alliance for Drug Endangered Children, 2.1 million children in the United States live in a home where a parent uses drugs. What we know about data is that we only know what is reported. For example, data like this often gathered through arrest records, case involvement with child welfare, inpatient treatment admissions, self-report, or other involvement with another system. We know that there are children and parents out there in our communities that do not fall in these 2.1 million children, as they have not been identified. To provide support to families identified as impacted by substance use in the home, we have partnered with the United Way of Greater Plymouth County's Family Center in Brockton. The Family Center works with families to increase resilience, build healthy coping strategies, and connect to concrete resources. The Family Center is easy to access. No referral or insurance is needed. Supports for families may include basic needs like food assistance, referral to therapy, and support groups. The Family Center helps families navigate complex systems such as schools, child welfare, court, and more. If you suspect something, do something. Please contact us with questions, to request resources, and more training. Thank you for your time.